Good morning, everyone. Today I am going to talk about the use of field instruction. As you know, some of you, I am doing my field experience at Frisbee Hospital, which is where I currently work as a nurse on the night shift. I am this semester, the remaining part of my field experience will be done on our geropsych unit due to some issues being had in the other department where I was currently working, which allowed me to go from floor to floor. I'm pretty excited about this because I have very limited experience in psych. Not only are we dealing with individuals that have dementia and Alzheimer's on this particular unit, this unit is for anyone over the age of 65. Younger individuals that have some depression issues, schizoaffective disorder, any other mental health issues can sign themselves in, but they have to be over the age of 55, and they have to be able to sign themselves in. Those that are over 65 can sign themselves in, but if they are incapacitated, they have to have their DPOA invoked, or they have to have a guardian sign them in. Last week, I was able to be a part of an assessment with a particular patient that had come in. She was actually quite young. Um, she was 64, excuse me, and she has been relocated several different times over the past year. I believe it was 3 times in 3 different facilities. Right now, she is able to maintain living in an assisted living facility. The current facility that she lives in at the moment has a little bit more staffing and is able to help her with her activities of daily living and kind of give her direction 24 hours a day, 7 days a week. And the particular facility that she lives at is what we call a continuum of care, excuse me. So she will be able to transition into a long-term care bed when it's available for her and when she needs it. This particular woman has suffered from major depressive disorder most of her life and also has a severe anxiety disorder. So I was able to be a part of this assessment with her daughter, who was very very there for her, advocated for her, but was also dealing with her emotions in regards to how her mother has drastically changed over the past 8 months. And the wonderful thing about the doctors that I work with on the geropsych floor are doctors that actually go to these facilities. So this has been a patient of this particular doctor's for about 3 years now. So the doctor is familiar with the patient is familiar with the doctor, as well as the family. The reason why a lot of these patients get admitted into our unit is because they need to have some med changes, or their family just can't care for them anymore, and it's now becomes the social worker's job to try and find an appropriate placement for them. Unfortunately, there really isn't a lot of long-term care options out there for these particular individuals, so it's kind of a little discouraging at times, and it's a lot of work to try and get them into a particular facility that will best benefit their needs. I turned to my field instructor, who's also my on-site supervisor this week, in regards to dealing with this particular patient. She has some expressive aphasia, which means she has a hard time finding words, which tends to make her more anxious. And on this particular floor, I'm able to spend a lot more time with these particular patients. I'm in the room with them for a considerable amount of time. A lot of my day is spent going from different patients that are appropriate for me to spend some time with. Because when these individuals come into our unit, it's a major disruption for them. They're used to a routine that they have, even though they have, memory deficits. It's definitely a huge change for them. They have a hard time adjusting. Some of them are combative and aggressive. Others are teary. And there are some that there's some barriers to be able to communicate with them. So I was able to spend some time with this particular patient last week and the week before. She was on our floor for 2 weeks. So I was able to go in and sit with her. And she's a very active woman, has been a very active woman, but she's not identifying with becoming old. She doesn't feel that she should have the restrictions that she has, but she initiated going into an assisted living facility because she knew her limitations at home and she wasn't able to do a lot of the things. And at the time, her daughter lived an hour away, so it was very difficult for her daughter to get there and try to make sure that she was getting her medications right and what have you. So the sad thing about this particular woman is that she has progressive Alzheimer's, and she is understanding that there's something changing within her and that she's very well aware of her disease, which is sometimes extremely devastating to watch because it gets them very frustrated. And whereas she has suffered from anxiety for quite some time and throughout her whole life, it's now tripled in effect for her. So my first conversation with her did not go very well. I had a hard time understanding her due to her expressive dysphagia and not being able to find words to try and explain to me what it is that she wanted. So I then approached my field instructor. We usually set aside a couple of hours in the afternoon where we can chat and discuss my day and see how things are going and what my plan is going to be for the next day. And so we sat down and we discussed with her, and I told her that, you know, the barriers are a little difficult. I said she gets very anxious, very nervous, and she has a hard time finding her words, which in turn gives me kind of a hard time trying to understand her, and I didn't want to put any type of words in her mouth as to what exactly it was that she wanted. So what it was basically, she told me to, you know, I asked her if it was okay if I could contact her daughter and find out if there's any activities that she liked to do when she's at her assisted living, what she does during the day, if maybe we could kind of mimic that while she's here to try and give her a little bit of stability and consistency and make her feel a little bit more comfortable. And she also had given me some suggestions in regards to dealing with her anxiety issues and showed me a couple of breathing techniques that were easy for this particular patient to do, which was wonderful. So the next day I went in and I set aside an hour and a half to be with her and to, I brought in an adult coloring book because her daughter said that that's something that she absolutely loves to do because when she visits with her grandchildren, they like to color together. So I brought that in and thought maybe we could have a conversation over her coloring and kind of decrease her anxiety a little bit. And so her anxiety kind of got the better of her in the very beginning, and then we stopped and I did some breathing techniques with her that my supervisor had shown me, who has been a licensed clinical therapist, social worker for quite a few years now. And I was very impressed to see that I actually did it correctly and that they worked. And this woman likes to be outside a lot. So when we found that she was having a hard time, we were sitting by the window, just kind of had her look out at the sky and take a couple of deep breaths. And when she did that, her voice level would raise and her speech was a little bit better. Her speech is never going to get 100%. She had suffered a stroke, so she's going to have some word finding issues, but she was able to stop and take a moment and gather herself and be able to kind of reiterate to me what exactly it is that she was discussing, which was wonderful, and that kind of alleviated a little bit of that anxiety. But I had also noticed that she was constantly bringing her hands up to her chest when she was talking. So she holds a lot of anxiety in her chest. And so, you know, that session with her went really well. We spent an hour and a half. We were coloring, taking breaks, taking some breathing. And she was generally very pleased and very happy that she had somebody to sit with her and talk with her and kind of break up the monotony of her day of just sitting in the room with the other patients that are on the floor, because she's a little bit more with it than some of the patients that are on the floor, so that was a little discouraging for her. And then that afternoon when we had our supervision and we were discussing, I had asked if maybe, you know, if we could contact her daughter and have her just kind of give her like a smooth stone necklace to wear, because she was constantly, all the anxiety is in her chest. And I said, well, maybe if she has that and she can, you know, rub that smooth stone necklace or something that that would kind of help alleviate. So her daughter actually thought that was a wonderful suggestion and brought one in the very next day, and I was able to see her in the afternoon, and she was playing with it and was able to hold a better conversation than she did the day before. And she really didn't need to do as many breaks with her breathing and just kind of trying to relax and think about what she wanted to say next, because her being able to hold on to that necklace was kind of like a little break in the front of her brain, and she was able to gather herself and then continue her conversation. So I think obviously field instruction is very important, and I was very, very thankful because I don't think I would have ever have come up with any breathing technique or whatnot, because I don't usually, I deal with patients that have anxiety issues, but I do it from a medical standpoint. And obviously the hospital runs on a medical model. So this was actually very different for me to do. I was actually able to spend more than 10 minutes in the room and, actually understand where this woman was coming from and understand her anxieties and her fears. So it was really nice to get some input from my field instructor as to how better to make this session go for her and make her more comfortable. So that was wonderful for me, and I enjoyed spending some time with her. She has unfortunately since left. She will be my, for next week, we have our ending with clients discussion, and that actually went very well between both her and her daughter. So I look forward to discussing that next week as well. But yeah, field instruction has been super wonderful for me in regards to this situation and in others as well. But this was a situation where I was like, I don't even know how to have a conversation with this woman. I don't understand where she's coming from. I don't understand what she's trying to say to me. And I could tell that she was getting frustrated with it. So it was wonderful to be able to go back to my field instructor and say, do you have any tips for me? Is there anything that I'm doing wrong that maybe I could improve on? So I'm hoping to get a lot more experiences like this so I can be better suited to be able to be with these particular patients and kind of make their stay with us a little bit friendlier, I guess. I shouldn't say friendlier, but more comfortable, and trying to kind of alleviate the stress they have of being in the hospital at that particular point in time. If anybody has any ideas or thoughts on communication in regards to dealing with individuals who have verbal issues, would be wonderful, because some of my patients are nonverbal, and I'm trying to find and do some research on coming up with ways to be able to sit with them and just be in the moment with them, but yet allowing them to kind of express themselves. So if anybody has any ideas, it would be greatly appreciated. I'm also going to discuss it with my field instructor as well, but I was kind of hoping to get some input from you guys. I know this is the long video. I hope that you all have a great week, and I will see you next week.